And we're live. We're live. Hello. Welcome back, everybody. Thank you so much for joining me. Good afternoon. How are you doing? This is a different time to our usual scheduled evening session. So my apologies, but thank you so much if you're able to catch me live or if you're watching this on the replay. Thank you so much for joining and welcome. I'm Dr. Sylvia. This is Ask Away Health. And in this session, I usually address viewers' comments or questions that have come in over the last week or the last couple of weeks. And today we're going to be covering the Depo shot and how it affects your bones. We're also going to be looking at a comparison between the drug Ryco and a hysterectomy. It's a question that was sent in by one of you. And then looking at treatment options for PCOS in a 15-year-old. I promise that you will pick up something useful, if not in all the 3 different segments of this program, or at least one of them, you'll pick up something quite useful. So before I go further into the program, I'm going to ask you to please give this video a like if this is the kind of information that you are looking forward to or you'd like to hear about, the kind of health information that you'd like to be part of. Please give this video a like. That would be most appreciated. And of course, consider subscribing to the channel. You're very much welcome to the Ask Away Health community. It's a real pleasure to have you on board. Now, please don't forget to check out the description box at the end of the program. You're going to find different links, a link to our website. On our website, you can join our mailing list for a monthly newsletter where we've got lots of helpful health information tips, and use our free symptom checker if you want to look up any symptoms that are sort of, stuck in your head. You're trying to understand what they're about, if there's something significant or not. We can give you some information to help with that. And of course, you can use that same website and the link to send an email health information or email health inquiry to me or one of our other clinicians to get a customized response to a health problem. And I'm just going to flip screens now and show you our disclaimer. Really important for me, because while we're going to having conversations around the questions that are sent into the channel, I want to emphasize that it's meant for educational purpose. Our conversation is not intended to replace your own medical practitioner, your own doctor. Please always seek the advice of your physician who knows detailed information about your medical background and can provide you the most appropriate information that will guide your health. So please bear that in mind. But you're always welcome to send in your questions. And if you're joining live, please, where are you watching from? Which of these particular topics has intrigued you for today's session? While you're typing all that away, hopefully somebody's typing that in the comment section. Let's take a quick break. I shall be with you in a second. Feeling unwell or dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. Excellent. Yes, a message from our sponsor. Please check out your GP consultation if you're UK based, where we're providing private online medical consultations and particularly tailored towards women's health conditions. Okay, so let's get cracking. Let's start with the very first question. Let me share this question. I'm going to read it out to you. Let me just pop the screen correctly. I hope you can still see me and the question. I don't know, because now I can't see either. I can only see the question. It's a very long one. And I'm going to leave it on for people to sort of read through, but I'm going to just sort of summarize it because basically, and thank you, you know yourself, whoever sent in this question, thank you so much. I really appreciate it. And I think it's really important. It's actually more of a comment than a question, but I think it's really important to think about and address. And, they said one thing that they were not told about this possible effect when they first started this medicine. So If you're here and you don't know about this side effect of the Depo shot, please listen up, okay? So this is somebody who says that they take the Depo. They've been very happy with the Depo for the last 3 years, but she's saying that she will have to stop it, or she's thinking of stopping it because she's just been told it's going to ruin her bones if she continues. Now, she says that she never knew about this, she was never told, and I take that on board. Sometimes there's a lot of information that we give to you when we're starting this medicine, so maybe you didn't hear it or it wasn't said. Whichever the case, she is in a situation where she's just finding out for the very first time. And this is a side effect that tends to happen after you've been on the Depo long term. So she's loved the Depo shot, basically. She's enjoyed not having her periods, but now she does feel that she's experiencing bone weakness. She's checked it, she's done her research, and she has confirmed that, yes, the Depo shot could lead to thinning bones after long-term use, making bones weaker and more likely to fracture. And that's why it's really important that they flag this up to her. And she was just sending this comment into the channel to warn her other sisters, watch out for this, be aware of this, and have a think about it. She says she's probably thinking about the implant. She says she thinks the stick in the arm will be better for her, which she can take away when she's ready, and she's not ready for that yet, maybe in a couple of years. You can see it's a very, very chatty I loved it because it's a very, very chatty comment. Like I said, it wasn't particularly a question, but the reason I brought it up is because of this comment where she was not aware. She's been on the Depo shot for the last 3 years. So let's address some of the issues in this particular question or comment. And like I said, if you are on the Depo shot and you've not heard of this before, please listen up. It is expected, whoever is doing your prescription or providing you with the prescription for this medication is supposed to inform you amongst the side effects that you could experience changes to your bone density, bone structure when you've been on this drug for a prolonged period of time. And in that case, what we recommend usually, let me say it off the bat, what we recommend is that every 2 years or at your 2-yearly review, your clinician has to review you totally to find out whether your risks of thinning bones or fracture and all that has increased, because it can slightly differ from person to person because we all have different biological makeup. Some of us have a higher risk of developing that. It might depend on our age. It might depend on other medication that we're taking or other conditions that we have. So that's why it's important to have an individual review, and it's done every 2 years when you're on the Depo. But let's backtrack a little. Why does this happen? The Depo shot is the progesterone-containing injection, progesterone-only injection. It contains a synthetic progesterone that is, human-made, similar to the one that your ovaries produce, that is called medroxyprogesterone acetate. And this drug is usually given, depends on the particular brand that you're taking. You might get it every 3 months, or you might get it every 2 months or 8 weeks. It depends. But whichever the case, they both contain a large dose of progesterone that is given by an injection. And what tends to happen when you have this amount of progesterone is that it can affect the amount of estrogen. Remember, the work it does is to temporarily put your ovaries to sleep and halt ovulation temporarily. Okay, so that means that you're not going to be producing your own natural estrogen and progesterone while you're on the Depo shot. Why is that important? It's important, and estrogen in particular, because estrogen is crucial for the development of our bones, the bone strength. It's because of estrogen that the balance is maintained between the breakdown of old bone and the formation of new bone. If that balance is messed up when there's low estrogen, then what you have is that more of the bone breakdown happens, and so you end up with a scenario where the bones become thinner, they become weaker, and so there is more risk of a fracture. This is what happens when you take this Depo shot for a long period of time. So you can lose this protective effect. And like I've said, the only way that we can monitor it is because we are aware of it. We have to check you over every 2 years is the standard usually for most for women who are on this injection. Apart from the time that you meet with your practitioner every 6 months or 3 months or whatever the case might be, every 2 years you will have a conversation. It will be a chat about your medical history, trying to find out if anything has changed, things that could potentially increase your risk even further of developing thinning bones or bone weakness. They want to know whether you smoke, whether you're taking steroids, what your diet diet and all sorts of things around any other medical conditions that perhaps have been diagnosed since you first started using the Depo. And we're putting all this information together because if we think the risk is high, then you might be referred to have a scan, a bone scan. It's called a DEXA scan. Some of you might have heard of it already. Some of you, your doctors may have referred you, or you may even have requested to have the scan, so that we look at what is the fragility of the bones, what is the risk of the bones fracturing, and that would help make the decision whether you should continue taking the Depo shot, whether it's safe or healthy for you to continue taking the Depo shot, or whether it's time for you to come off the shot. So this is the summary. This is why this is an issue. This is why it was brought up by this lady. Very, very correct for her to bring it up as a concern. I would say that when you're about to start the Depo shot, there's quite a big range of side effects that you may be told about. You might have a conversation with your practitioner about several different things, irregular periods, perhaps mood changes and headaches and so on. They should also mention the effect on the bones. It's a very long list of possible side effects. If it was left out or you were not familiar with it, here is your call to check in with your clinician. If it's something that you've not heard of and you've been on the shots for quite some time, please go and have this conversation. Sit down, let them assess and determine whether you need to have a scan, whether there are any increased risks, whether this is a method that you need to switch away from to other alternatives that do not have this same effect on the bones. And there are quite a number that you can switch to. So guys, let me know what you think. Have you had this experience before? That's a very first question. If you've ever experienced this, I'd love to know. I do get a lot of feedback, especially around the Depo shot when it comes to side effects, but I'd love to know whether you had this particular experience with regards to concerns over your bones. How did they deal with it? How did you find out? How did your clinicians deal with it? And so on. Please let us know in the comment section. And while you're doing that, please give this video a like, and I would really, really appreciate it. But that is the first question done. Let's take a quick break, and then we're going to come and deal with the very second question. It doesn't give me enough time to take a sip of water. These little breaks. Okay, right. So welcome back. If you're just joining, thank you so much. I'm Dr. Sylvia. This is askawayhealth.org. I know you can see your GP consultation. That's our partner. I will share a little intro video about the service in a little while, but it's a private online consultation service for UK residents. If you want to book an appointment with a GP and women's health specialist, then your GP consultation is the place that you need to be. But we're talking about different scenarios, different comments, questions that have come into the channel over the last couple of weeks. And one that was particularly interesting covered the issue of endometrial thickness, or the thickness of the womb lining. So let me share my screen again, and I'm going to pull up the question so that we can read through it together. Thank you again. You know who you are, but thank you again for sending in this question. And I do respond to these questions at the end of the stream, perhaps after a couple of hours when I'm just tidying things up. I will put the link to the video in the question so that you can see how we've addressed it, how we've talked about it. But I really appreciate your sending this in. Thank you so much. Now, this is somebody who's having this experience. Let's just go through it. So they're 38. She's 38 years old with 2 children, and she says her endometrium is 28 millimeters. She has heavy periods, and as a result of that, she's anemic. She feels tired all the time. She struggles some days to get out of bed. So that's, quite anemic, and it's really affecting daily routine, especially when it comes to, work and other activities. She feels that it's affecting her significantly. Of course, it affects her moods, they're up and down. Anyway, she was offered a hysterectomy by her doctor, by her gynecologist, because she has had bad side effects with hormone treatments in the past, she tells us. Now, she also says that when she had her C-section, remember she says she's got 2 kids, and she's 38, okay? So her last C-section, she was sterilized, so she's not having any more children, but she's having second thoughts about this procedure, which, as you old, at the age age of 38, even at the age of 60, of course you should have second thoughts. It is a major surgery. She's having second thoughts about the hysterectomy. She's asked her doctor if there's an alternative treatment before going down this avenue. Very good. Very well done for asking about alternatives. Well done for thinking about it. And he told her about Ryco. And she's gone and read about this drug and the side effects, which has led her to think that what is the safer option? Is it Ryco or is it the hysterectomy at her age? Which is the safer option? Her doctor has told her it will be a partial hysterectomy as she'll keep her ovaries, which is correct, which is good, yes. What would be your advice on which route to take? So she's saying, what would be my advice on which route to take? So thank you again for this question. I'm going to take it off the screen because I think everybody has sort of got the gist. Thank you so much for sending this question. I was really intrigued when I read it because there's so much to unpick there. This is a young lady still within the reproductive age that is asking this question. And the question is really about these two options that are not necessarily anybody's cup of tea, but they have to be addressed. Now, I just want to quickly touch on the issue of womb thickness. Womb lining thickness is 28 millimeters. And again, one of the reasons why I don't like to comment too specifically about people's conditions is because you don't have the whole picture. You don't have the full picture. So 28 millimeters, technically, depending on the phase of your cycle, may be considered normal, depending on the phase of your cycle, especially if you're still having periods, okay, because it ranges. Let me just share an image on the screen. I hope you guys can see it. So this image, sort of wavy lines is showing the thickness of the womb, and it changes pre and post ovulation. So it changes between the first half of your cycle and the second half of your cycle. It's usually thinner in the first half of your cycle and then thicker in the second half when you've ovulated and your womb is preparing for the implantation of the egg. So the womb is getting thicker in order to be able to support the egg. So that's when it should be a thicker size compared to the first half when the hormones are just still trying to get higher. The hormones are still, the levels of the hormones are still rising, gradually rising up to the point where ovulation happens. So for somebody who is still having her periods, this womb thickness could be within a normal range. But of course, what you want to do is make sure that you know when it was checked, at which point it was checked. If the doctor has any concerns, I'm sure they would have mentioned wanting to do more tests like a hysteroscopy. But it seems to me that the issue is that she's having a lot of bleeding, which is causing so much problems. She told us about the anemia. She told us about the tiredness, can hardly get out of bed. A mom of 38 with 2 kids. You can just imagine how challenging that must be. Thank you so much. If you're just joining, I can see a few people sort of lurking in the background. I appreciate you. I would appreciate a like even better. I would appreciate you even subscribing to the channel as well, even more. But that support will be so much appreciated, and it's free. It just tells YouTube that what we're doing is of some value, and I would really appreciate that support if you would not mind. Of course, you can also share in the comment section where you're watching from, and that would also let me know the reach where we're getting to. But anyway, back to this issue that we're tackling here. So we're asking ourselves the question about the value of Ryco versus hysterectomy and the treatment. This is for treating heavy menstrual bleeding. A hysterectomy, of course, as you know, is the removal of the womb. A partial hysterectomy is where the womb itself alone is removed and the ovaries are left in place. And the reason that's done is because you don't want to push somebody into menopause before they have reached the natural age of menopause. So by leaving the ovaries in, it means that she will still produce her reproductive hormones, even though the womb is not present, but she will still have her reproductive hormones produced, and so she will not experience the symptoms of menopause. One of the side effects of having a total or complete hysterectomy before the age of menopause is because the womb and the ovaries are taken away, the levels of estrogen just fall, estrogen and progesterone, the levels just fall, and that is pretty much what happens when a woman has reached the menopause. So the plan is for her to have either a partial hysterectomy, those are her options, and we're trying to treat heavy menstrual bleeding. And she says to the doctor, I'm not really keen. And let's remember, she said something. The decision for the hysterectomy, I don't think they rushed into it, because she did say that she's had challenges with other hormone treatment. And so I think that she and her doctor sort of sat down and looked at this from top to bottom, and based on her previous medical record. Remember what I'm always saying to you about how we can't make diagnoses here, because you need your own doctor who knows your medical background to be able to give appropriate insight into these issues. So they've had conversations. It looks as if she's had issues with hormone medication in the past. She didn't specify what those problems were, but that's not a route that she wants to go down. But she's also a bit hesitant, concerned about hysterectomy. She said she had sterilization. So this is somebody who has made up her mind that she's completed her family. And, you know, we're all different. People can make decisions and judgments, and it depends on who you are, where you are, and that's fine. She's come to that place. So we're just looking at what are the options available. Now, if she has the hysterectomy, she has the partial hysterectomy. One, she's not going to experience those early menopause symptoms because remember, it's a partial hysterectomy. Her ovaries are retained. So that's one. Of course, she would experience the initial complications of having to recover from surgery following a hysterectomy. But if it's done in a very reputable facility by skilled surgeons and clinical team, then the likelihood of any complications is probably very, very low. And she should be able to recover and get back into doing things as normal in a pretty short time. And this will probably be the end of the challenges that she would have with heavy menstrual bleeding because the womb is not there anymore. So the hysterectomy for some people could be a very suitable solution, but not everybody wants that. Not everybody likes the idea, and we are all entitled to have our own preferences and our own beliefs and how we want to live our how we want our bodies handled. And this is why it is great to have the options, the different options from one person to the other. But that brings me to this drug, Ryco. Now, you may have heard of it or not. Based here in the United Kingdom, it's a drug that we are familiar with. It is used to treat fibroids and recently also for treating endometriosis and really for managing the heavy bleeding problems in those conditions, usually started under the care of a gynecologist. But what is the drug? So the drug is a combination of 3 different medicines. And very briefly, let me explain how the drug works. So it contains one drug which blocks the messenger, the hormone messenger from the brain that normally instructs the ovaries to make estrogen and progesterone. It blocks that hormone. And so what that means is that drug, if you take that drug alone, your body is not going to produce estrogen and progesterone. In other words, your ovaries go to sleep, really. And so taking that drug means that estrogen and progesterone are not being produced. It means that the womb is not going to respond to estrogen and progesterone. The womb lining will become very thin, and so it's unlikely to bleed. So if you think about it theoretically, that's excellent. That's exactly what you need in this kind of scenario. And if that drug is taken alone by itself, you might develop side effects to that problem, because remember, I was just talking about menopause effects. If you take away the ovary, taking away the ovary is like putting the ovary to sleep. You're going to have menopause effects. So a side effect of that one half of this drug is that you could have menopause effects. So that could be from hot flushes to mood issues to all sorts of different things that might develop. However, to counter this problem, they added small amounts of synthetic progesterone and estrogen into the mixture to make Ryco. So Ryco is a combination of 3 different drugs, something like a combination of birth control pills plus that hormone that blocks the messenger from the brain. I hope I've been able to explain that in a way that makes sense. So what it means that when you take Ryco, it's a drug that will block the messenger from the brain that instructs the ovaries to produce hormones. The ovaries go to sleep, and so the womb lining will get thinner. However, to counter any potential side effects that might develop from that action of putting the ovaries to sleep, you have a tiny bit of birth control introduced in the preparation. So it's quite effective in what it's supposed to do, to control bleeding from things like fibroids or endometriosis, or in this particular instance, it makes sense, somebody who has a thickened womb lining and who is bleeding excessively. And I'm going to assume that they've done all manner of tests and things and know that her bleeding problem is as a result of this, her heavy, her thick womb lining. So those are the 2 options that we have on both sides of the platform that we need to decide, or that this lady needs to decide. Should she go for the hysterectomy, the partial hysterectomy, which, to be fair, once she's had the operation and recovered from the operation, that's it. She's unlikely to experience bleeding problems because the womb itself, the tissue, the organ itself responsible for that bleeding, that's done. Or should she go for Ryco? Now, I know I've described Ryco and said you have the contraceptives added into the drug to minimize the effects, but that doesn't mean that drug itself will still not have effects, side effects. It does still have some side effects. So think about it. You're going to be taking this drug every day because it's prescribed for daily use, taken by mouth. You're going to be taking it every single day. It's going to take some time before it comes into effect. We have to ask ourselves the question, is it going to be effective for you? We don't know. It's an effective drug, yes, but perhaps there are some women for whom it may not make any difference. So you need to take that on board, that you may be one of those people that it doesn't work. And this is, I'm not saying this because of any one thing or the other. I'm just saying that sometimes the medication may not produce the effect that we want in some women. That's simply the fact. But we don't know what's going to happen until you start taking this drug. So we're going to wait some weeks and months to see what the effect will be for you in particular. And number 3 is that you might develop side effects to the drug. You may not, but we don't know. You have to consider that you might develop side effects to the drug. So that is a potential risk you have to consider. And the effect of the drug is temporary. So you're going to keep taking this drug to control for as long as you have your womb, up until probably the time that you're perimenopausal or menopausal, when your womb lining becomes naturally thinner because your body is producing less estrogen. You're going to continue taking this drug because it's at that point when you get to the natural age of menopause, after 10 years or thereabouts, that your doctors can say, right, let's come off Ryco, let your body do its normal thing. And because your natural levels should be getting lower at that time, that's when you're likely not to need the medicine again. So you have to think that you're going to be on this drug. If it's effective, if the side effects don't bother you, you're going to be on this drug for between 5 to 10 years or so. So those are the 2 options. I wonder what other considerations have been given. Remember that you said that you don't do very well with hormones. This is a hormone medication. This Ryco is a hormone medication. So we have to wonder, what problems did you have with hormones in the past? Could these problems come again? That doesn't mean that you shouldn't try it if you wanted to go down that route. It's just, let us be aware that is a consideration. The other thing I wonder is whether you and your doctor have considered or had a conversation about something called endometrial ablation, which is when they use light or heat therapy to destroy the womb lining in order to deal with problems just like this, heavy menstrual bleeding. I don't know if it's something that you guys have discussed, because that is a third option altogether, which doesn't take the womb away, and it's not in taking this medication. It is something that can be done as an outpatient procedure, and many women are usually able to bounce back into their work or other activities in a very short period of time. Endometrial ablation, has that been considered? I would ask the question. I don't know. Maybe you guys have, and it's something that you don't want to go down the route. I don't know. Well, you did talk about hormone issues. I would have mentioned things like the progesterone coil, the progesterone IUD, like Mirena, Jades. It's got different brands, which we use to treat heavy menstrual bleeding. So I don't know if that is something that has been considered. But what I've tried to do is establish that with the hysterectomy, the initial, the thought, the finality of that may be difficult to contend with. I totally appreciate that. But it is the one measure that really puts all this down, really stops all this, from happening, basically. And if it's partial, then you're likely to not experience any untoward effects. But let's bear in mind that hysterectomy is major surgery. I don't want to underplay the significance. It's important. Things like infections could develop, bleeding could develop as side effects from the surgery. Very, very minimal if you're in competent hands and in a competent facility. But let us keep that in mind. We've talked about Ryco and how it works and what it's supposed to do. It's said to be very effective. And I've just challenged the thinking that, well, it may not work for everybody. Number 2, there may be side effects. Number 3, you're going to be taking it for a long time. You're going to keep taking this drug. It's going to be a daily medicine for, several years, maybe 5 years, maybe, up till you get to the point of natural menopause. And I'm just bringing these up as points to consider with your doctor, because I can't tell you which to do. I can't say to you, this is the way to go. But then I've also introduced another option, which you probably have discussed with your doctor. I don't know. If you haven't, then maybe something called endometrial ablation may be a useful thing to talk about. And of course, in making this kind of tough decisions, having conversations with your loved ones, and getting as much information as you can about the different procedures perhaps asking your doctor, what is it that they expected, right? Or what other women have experienced like yourself, in terms of side effects, in terms of the benefits. So you can have that, go away with that information, go and sit down and have a think about it before you can make your decision. I hope that my explanation and the sort of thoughts I've shared will help you to make that decision. And again, I really, really want to thank you for sharing that question with us to sort of have a chat and have a think around. And if I think of anything else, then of course I'll add it when I share the link in the response to your question. Okay, guys, thank you so much. Please don't forget to give this video a like. I'm just going to give us a couple of seconds. Let's take a quick break, and then we'll come on to tackle the question number 3. Feeling unwell or dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. Thanks, Your GP consultation. Thank you guys for sponsoring this live and sponsoring sessions here, and welcome back. Thank you so much. If you're just joining, I'm Dr. Sylvia. This is Ask Away Health, and here we talk about health information, especially as it pertains to women, sexual and reproductive health. And we've just been tackling 2 very interesting questions/comments, and I'm open to questions that you send onto the channel via my YouTube, Facebook, or whichever platform. And then we can sort of have a look at the questions. And I always say that I do not provide specific advice. I'm just trying to look for my disclaimer. I don't provide specific advice, but I do provide information that would help you sit down with your own medical practitioner, that would help you signpost you to have conversations that will move you forward in the best way possible. So we've been talking about those 2 conditions I've just talked about, and here talking and here we have another question that's been posted. And again, thank you so much to whoever sent in this question, and I love this one. I've not dealt with a question like this for some time, and as you can see, hopefully, as you can see from the screen, I don't know if you can see, so yeah, let me just share it like that. So this one says, my 15-year-old was just diagnosed with PCOS, polycystic ovary syndrome. The pediatrician suggested metformin or birth control. What do you suggest? This is a very nice, short and sharp question that we have to tackle. So what do you guys think? As usual, I welcome comments. I don't know if anybody has had something similar, had a similar challenge or question, and I have a few thoughts. About this, but I'd love to hear back from you guys. If you're watching on the replay as well, let me know what you think. So I have a few thoughts. PCOS is something that, I think it's good to get a diagnosis early. The worst thing is for somebody to continue from their teens into their mid-20s or 30s before they eventually get a diagnosis. I'm pleased that there's a diagnosis at this stage, when you can start to plan ahead and start to try and do as much as possible to reduce any complications. And a large number, I think, of teenagers, when I say large, well, a significant number, not huge, but are getting diagnosed because early puberty, obesity is more an issue. And I'm not saying specifically about this particular teenager. I don't know them. This is all the information I have about them. But just looking at the evolution of society and culture, we are heavier. Children are, starting puberty earlier. Those are some of the things that may be associated with these diagnoses. But PCOS, polycystic ovary syndrome, is a condition where there are irregular cycles, where you can have irregular periods, heavy menstrual periods, skin problems like acne, oily skin, unwanted hair in different places, so hair around the face or the chest in women, feeling tired, skin changes, not just acne, but darkening of the skin. And of course, for some, it could also be associated with fertility issues. So this has come to their attention and it's been diagnosed. And the question now is around the treatment. Okay, and I think that most parents would, not want to start their children on medication unless it's absolutely necessary. And I think there are a few good reasons why either of these medications would be important. But I think it's also very important at this stage. It's really important to emphasize the significance of lifestyle changes or lifestyle adaptation or whatever you want to call it. Significant changes that can improve PCOS in particular, because when we're treating this condition, the first thing that we usually do is look at your lifestyle. So look at diet, look at weight, look at exercise. Those are the key things that we start with. And you usually start with them and then go on to include things like medication. They're both really important, is the point I'm trying to make. So hopefully a conversation has already been held about looking at diet in the way to maximize healthy eating, low glycemic index foods that will encourage a healthy weight or weight loss if it's necessary, a healthy weight, and then things like exercise, get into that habit and pattern of regular exercise, to keep weight down. And the reason why it's important is because this is a condition which, if not properly managed, can, as a woman grows older, increase the risk of metabolic conditions like diabetes and other conditions. So PCOS is not just a gynecological or reproductive problem. The issue with PCOS is not just about fertility and periods, even though those are very important. The impact on mental health, because things are not regular, because of the challenges associated with the condition, the impact on the body, on the metabolism, and like I said, the risk of developing conditions like diabetes in the future, very high with this condition. And of course, the issues around fertility as a person grows older. Not always, because it can be on a spectrum. There's some women with PCOS who do not have fertility issues. But if you go down the spectrum, there's another group of women on the other end who do have problems with fertility. So, but the issue that we're supposed to be tackling is really about metformin and birth control. So why is birth control an issue with this condition? Well, it's supposed to be important for helping to regulate the cycle, because one of the issues that you have with PCOS is an irregular cycle. It may be that somebody goes 3, 4, 5 months without a period, and all of a sudden, boom, heavy bleeding for several days or weeks, and then after that, maybe that lasts for 7, 10 days. It varies, or even longer, it varies. Then there's no bleeding, and then boom, another heavy, because of irregular ovulation going on, thanks to the immature follicles within the ovary, which is part and parcel of the condition. And if you want to learn more, please go and check out my playlist. I will put it in the description once I've done with this live stream, so you can learn more about what PCOS is and how we think, what happens in this condition and how we think it develops. So birth control is useful for helping with the cycle. It can help with acne, which I mentioned earlier is a problem that can develop with PCOS, and it's also helpful. One of the other conditions that I didn't mention that could be a complication of PCOS is the risk of womb cancer, and so birth control can help to reduce that risk. So there are benefits for taking birth control. What about metformin? What is the metformin? What's the purpose of the metformin? Now, metformin, I've mentioned about the metabolic complications for PCOS, the involvement of hormones, because really it's hormone imbalance and lack of hormone regulation that is the problem we have with PCOS. And one of the hormones that, apart from the estrogen and progesterone, testosterone levels, high testosterone levels that we have, is abnormal metabolism, balance of insulin. So metformin is supposed to improve the way insulin works in the body, so it reduces something that is called insulin resistance, and it can help with reducing weight to one that is a healthy weight, helping to maintain a healthy weight. Not only is that more healthy for the tissues and reducing the risk of developing diabetes, reducing the risk of developing heart disease, but it can also help in fertility. So these are important medicines. I think the issue here is having the conversation with the teenager and explaining to them what is the commitment, because the commitment is about taking these medicines regularly, and perhaps they might be in a situation where a birth control pill is what is needed because the periods are just all over the place, and it's you want that regulation. And so that could be what would be the first focus. And perhaps after some time, then the metformin could be added on, because really the metformin is important. It's an important drug for the reasons I've mentioned, already. So I think it's worthwhile having a discussion with your teenager, and the pediatrician to see what are the, what's the recommendation. This is a lifelong condition, but it can be managed to the point where it doesn't affect, the choices that she makes in terms of career, having a family, and so on. It can be managed once it's recognized, diagnosed, and properly treated, monitored regularly to minimize any of those potential risks. So I think involving your teen in this decision is important. Both medications are important for different reasons. We have women who are on both medications because if, for example, they're not ready to have to start their family, what you want to do is control their cycle. What you want to do is control any of those conditions that are associated with high testosterone, like the oily skin and the breakouts on the skin. You want to control that. And then it gets to the point when she, in a few years, when she is ready to have a family, she decides, okay, she's going to come off the birth control, and then she can, start going down that route. So I think it's a conversation. I think it's a conversation to have with everybody, the parties involved, so that you can make the right choice. There's no right or wrong choice. The key thing is monitoring. The key thing is understanding the condition, accepting the condition. And please don't forget lifestyle. Don't forget lifestyle. Really so important in helping us to live healthier, to have healthier lives. So those are my thoughts on this. Those are my thoughts on this question on, which is the best. I'm not going to say there's any best. I think it's about having a discussion with with your daughter, explaining what the function of both of the medications are. There might be room for having both of them, but there might be room for starting with one first and then moving on to both at a point in the future. Those are considerations to be had. Thank you so much for putting in those questions. I appreciate it. And thank you so much to everybody who's joined for today's live. Much appreciated. Thank you so much. I would love to know, if you watched the replay, if you managed to catch any of these segments, which intrigued you most, which did you learn from the most, and of course, can you send in any questions? Absolutely, please do. I always pick these questions directly from my comments box. I don't make them up because I think they help us to learn. I think they somebody else may be experiencing those same issues and wants that kind of information. It might be helpful. As always, I would recommend that please go and see your own medical practitioner. Get a second opinion if you need to. Try and get as much information about things as you need to make informed decisions. Lovely. Thank you so much for spending time with me on a Monday afternoon. I will hopefully see you again, not too distant future. But until then, stay well. Bye-bye. Feeling unwell or dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today.